also from police personnel who have tested positive to naval officers who have tested positive. Let's hear from some health workers as well from various health centers here in Accra, sharing with us some of the challenges they face at the forefront of our fight against coronavirus.
Looking at the backlog that we have, once we receive the samples, then we are also trying so much that we put much effort to make sure that we are able to clear the backlog. We pull it as quick as we can, and then we send it for extraction so that the final amplification could be done, and then the results are out. So you realize that there are always samples coming. You always have to be on your toes to work.
My name is Joyce Ado, a principal nursing officer. I've been in charge of the triage area where we screen people before they enter the hospital, from the one that we started on in March. So it's been very hectic and very scary coming close to people who are later diagnosed as positive, and without enough PPEs, the requisite PPEs to use. So we've been working like that till now. But the greatest challenge that we face is for the people to accept the reality of the infection and then comply with the regulations that can curb the spread.
My name is Naomi Edu. I'm a principal nursing officer for Yabaso North Health Directorate, and then in charge of the contact tracing team. People are now no more owning up even when they tested positive. They don't want to own up again. You call the person, your results is in, and then I have to see you to break the news, to tell you how your status after the test. And I'm like, the person is like, I don't need it anymore. You can take your results. I'm not sick. Don't call this line again. The next time you call this line, I will look for you and then kill you. They threaten you, at least tell you things that will make you very scary.
Roxana, our fears is because the disease is highly contagious, as all of us will know. And we are afraid to send this one home. It's not only about ourselves, but to send it outside. And that is the main fear that we are having here. Because we are young, our immune system definitely can fight the issue, but we have family at home. We have elder people, we have children too, and this is the fear.
Even though so many pathologists have shied away from performing a post-mortem. If I can tell you, I slept for only 2 hours last night. When I woke, I couldn't sleep since 1 a.m. I've been thinking as to what to do, what precautions I will take. So it's been quite difficult for me.
And your family, how did they take the news that you are going to be one of the very few people conducting this for the first time in this country? How did your family take this?
Some of them say I shouldn't come back to the house. But I was able to convince them that I will wear the right PPEs and nothing will touch me. I will do everything that is necessary.